Oh, I think so. I have no doubt about it. I'm not worried at all at sending you home to Dr. Wilshine.
Well, you know how men are. Frank thinks he has to question everything Dr. Wilshine does. I think he just doesn't like me having a male gynecologist.
Well, you can tell Frank, or I can tell Frank, that Dr. Wilshine does everything by the book. An updated book, too. He knows what he's doing, even if he is a man. Now, I'm going to send a nurse by to draw some blood, and then a resident, Dr. Jenkins, will be by with some students, and you're going to be the star of their lesson. Is that okay?
Do I have any choice?
Well, yes. But we can't teach these young doctors without the help of our patients. They're not going to be examining you. They're just going to be talking about you. Do you think you can stand that just one more time?
Bring 'em on. I'm getting used to it.
Great. Then I'll be by one more time, and then it's home you go.
Mm-hmm. He thinks they're all golfing buddies and they cover up for each other.
Well, they might. But I don't think Dr. Feeney even knows you're Dr. Wilshine. So I doubt if she's covering up for him.
You don't think she knows him?
I want you to hold it up for me for a minute, just like that, okay? Well, I'm not saying that she doesn't know him. I'm just saying that she's probably not covering up for him. You live quite a long ways from here, don't you?
120 miles.
Well, see, it's not like they're good friends. And believe me, doctors can go at each other like cats and dogs when they're not good friends. Sometimes even when they are. Ah, that's looking good. There you go.
Now, Mrs. Clayton's case presents an interesting problem. Had we discovered her fibroids earlier, we could have tried hormonal therapy. Now, fibroids can have various sorts of clinical
What did you say?
Had your Dr. Wilshine discovered your fibroids earlier, we could have tried hormonal therapy. Now, fibroids, as I was saying, have various clinical
Wait a minute. Would that have saved me this hysterectomy?
Well, we don't really know that for sure. And it's most likely just as well this way. This way, you've had your hysterectomy, and the problem's all gone with, and when you go home, you won't have to worry about having this problem anymore. Now, as I was saying, fibroids can have various clinical presentations. They can be totally asymptomatic. They can present as new onset of mid-cycle vaginal bleeding. They can present as increased vaginal bleeding, either in the total amount of flow or the duration of flow. There are various ways that you can treat fibroids. You can treat them medically. You can just observe them and see how the patient does. You can go to surgery. If the patient's bleeding, you'll need to follow hematocrits and see how much blood the patient is losing and whether or not she's becoming symptomatic from that.